It's always challenging working in Gaza, but of course, hugely rewarding as well. And there are wonderful people to work with. But the circumstances under which they're working now are, as you can imagine, appalling. And they're working in a healthcare system which is on the verge of complete collapse.
Tell us what you were doing there, what you've been doing over all these years.
So I've had two roles over there. I've led a team of doctors from Oxford to teach medical students and doctors over there every year for nearly 15 years. And in recent years, I've also been working with Medical Aid for Palestinians to carry out and teach surgery out there. My particular specialty is cancer of the stomach and the esophagus, and so I've been helping them set up advanced cancer surgery services to treat those patients.
How on earth, as a doctor, do you care for or even operate without the medical supplies that we're hearing about are in such short supply?
So, I mean, they're always in short supply over there, but in times other than these, they have enough to allow us to do fairly major surgery, although we do have to use equipment which perhaps is not quite the same as we're used to over here. But now, of course, their supplies have either completely run out or on the verge of running out. They have virtually no more blood products left. They've run out of surgical gloves. So between operations, they have to wash surgical gloves and use them again. They've got very little water. They currently run out of fuel for their generators, so they have no electricity. They've in Shifa Hospital, which is the main hospital I've worked in, on several occasions in the last 3 days, they've run out of fuel. Their generators have stopped. They've been unable to run any equipment that requires electricity, such as ventilators, until they get a bit more fuel in. And they're now running them again, but they fear it'll run out again in a matter of hours.
Which patients are at greatest risk in the face of these conditions?
The only patients they can treat at the moment are victims of trauma. They are overwhelmed in their services, so they cannot treat all the patients with trauma. But patients with other medical conditions, such as cancer or diabetes or infectious diseases or heart disease, they really cannot treat at all. So those patients will not get any treatment. And even the trauma patients, they're now overwhelmed and are struggling to treat all of those.
We got a sense in that film of the harrowing conditions taken on by the healthcare professionals in that hospital we filmed in. I mean, it must be almost intolerable.
Yeah, and I'm talking to colleagues of mine on the ground several times a day or in messages. We can't always get telephone communications for obvious reasons, but I'm getting messages on a regular basis. Other colleagues of mine from Oxford are in similar contact with their colleagues. So we're getting a very clear idea of what it's like, and they are in a desperate situation. They're all working hard. Many of them have lost close family or friends who've been killed. We know doctors and nurses and medical students who've been killed in the last week. Some of the people I know very well are working, not knowing whether their families are alive or dead because they can't communicate them. So, and yet they're still working. They've been told to evacuate by the Israeli government, but they're refusing to leave. They're refusing to leave their patients, even in the knowledge that they may well die as a result of staying where they are. But they will not leave.
Sorry, you were supposed to travel to Gaza this weekend, I think. I mean, when do you think you'll go back? When will it be possible to get back in?
I don't know. You're absolutely right. I was meant to be travelling out today. In fact, we had a whole week of cancer operations that we were lining up to do. I'm in regular contact with Medical Aid for Palestinians, which is the wonderful UK-based charity who supports me going out there. And they are looking for volunteers and building up a team of volunteers, of whom I am one, to get out there as soon as there is a ceasefire and it's safe to travel. But when that will be, who knows?
Nick, good to talk to you. We wish you well with your work, and thanks very much for coming on the programme. Professor Nick Maynard,
Thank you very much
consultant surgeon at Oxford University Hospital's NHS Trust.